discussed already by Ms. Jancy. And actually, this is the extension of positioning. For patients with problems with the spinal cord, those patients who had an accident, or those patients with surgery at the back, we cannot just position them on lateral and left lateral without pushes on their back. In such cases, we follow Logrolling. Just like a log, just try to explain to your student. You have a log, when you turn one side, you turn the entire log. Wood.
Oh.
You know a wood, when you turn, the entire body is turned at the same time. Okay? And that is our procedure for today. We do not want to cause strain or stress on the back. That's why we're going to do the Logrolling technique. Because they might ask, student might ask, what's the purpose of this? Okay. And the things that we're going to prepare is, very common. We need to have a turn sheet always. See? And we need to have additional pillows. We need at least 3 additional pillows with you. Okay, what is the first step? You need to decide at which side you're going to Logrol the patient. Is it on the right or is it on the left? Okay? Why? Because the initial step is to pull the patient on your side. Okay. So, I am planning to position the patient on left side. So the first thing is to pull the patient on the right side. So I will ask my other nurse to go with me here. Okay, don't you worry, there are 2 things that you can do. It's either you use the turn sheet or you do manually. We will not make things difficult, we will use turn sheet.
Yeah, we do not do manually.
Okay? Okay, we have the turn sheet here. So the first thing that we're going to do is to move the patient to the right side. Okay, 2 nurses should be on this side. We have the turn sheet, and we need to roll this one as close as possible to the patient. And we need to prepare the patient as well, just like what we did earlier. Hands on both chests. Okay, we need to have, okay. And then, if there is an involvement of the cervical area, you can ask another nurse to hold the head part if there is a cervical injury. Okay? Like this. Okay. Now, just like what Ms. Jancy said, the nurse should prepare themselves as well to prevent back injury. 1 foot forward and 1 foot backward. And we're going to count 1, 2, 3. And then with the rocking motion, we're going to pull the patient. Ms. Jancy, 1 foot forward. Wait. Okay. Okay, 1 foot forward.
Actually, you can put it on this, which is easy, but for this procedure alone, Logrolling alone, we are not supposed to do this.
Cross on.
It can cause problem.
Okay, now if the bed is very low, you can actually elevate the bed because it will break your back. Just like right now, I think this is very, very low for me. Okay, that's okay. 2 nurses on both sides. 1 foot forward, 1 foot backward. At the count of 3, there should be a leader who will count. At the count of 3, I'm just going to rock like this. 1, 2, 3.
Because of the legs, usually if it is like this, no problem.
Okay. Now, if the patient is already on this side, 1 nurse will go to the other side. Okay? And at this point, we're going to put the supportive devices. Okay? The nurse on the other side will reach this turn sheet, specifically on the shoulder area and on the hip area because this is the heaviest part. And the nurse on the opposite side will do the same.
My height will not reach.
The hand is short. The same process, 1 foot forward, 1 foot backward, and going to reach out the shoulder area and the hip area. Okay, and then
1, 2, 3.
yes, the same count, 1, 2, 3, and the nurse on the opposite side will push as well. 1, 2, 3. See, the back is straight. There is no pressure and stress on it. At this point, we're going to place the supportive devices. We have additional pillow in the back, and we have additional pillow on the chest area. You would observe observe that there's a minimal pressure in the back because we want to avoid any pressure or stress on it because the patient had surgery at the spinal area. And then you can cover the patient with the bridge. Logrolling.
So moving up in the bed, this is Logrolling. Okay?
Only this pillow between two legs.
For a while. Because we need a real patient for transferring the weight.
She might say
Yeah, wala. This is quite, the procedure is quite physical for you, I know, but you don't have a choice.